This educational model is intended to facilitate your knowledge and understanding of heart failure and the complex interplay of treatment modalities involved in heart failure management. You will also learn how to effectively share your knowledge about heart failure when educating heart failure patients and how to guide them to participate in their own disease management. We appreciate your devotion to the patients and caregivers you will serve as a professional nurse in your crucial role of patient educator. After completion of this cardiac educational model, you will be able to define heart failure, describe cardiac principles, signs and symptoms of heart failure, identify treatment modalities, and the treatment modalities used to manage heart failure. You will also be able to discuss the necessity of symptom management to enhance patient outcomes. You will define self-care management of heart failure, understand the significance of patient education and self-care management, and learn heart failure self-management principles. You will also identify patient barriers to learning, learn essential clinical components of patient teaching and learning, understand the importance of patient-centered care, understand the correct use of the teach-back teaching method, and you will understand the importance of performance-based learning. The proper functioning of the heart is crucial for the health and well-being of an individual. The heart is a powerful muscle whose function is to pump oxygen-depleted blood from the right side of the heart to the lungs for oxygenation and oxygen-rich blood from the left side of the heart to the entire body. Each chamber and major blood vessel leading into and out of the heart has a specific function during the cardiac cycle. Since you have recently learned these in your physiology and pathophysiology classes, I will ask you to refresh your memory regarding cardiac function. Heart failure occurs when an abnormality of cardiac function causes the heart to fail to adequately pump blood throughout the body, or when the heart is unable to prevent blood from backing up into the lungs. To put it simply, the heart is a pump, and heart failure is pump failure. The most common causes of heart failure are coronary artery disease, hypertension, dilated cardiomyopathy, myocarditis, heart valve dysfunction, and pulmonary disease. Approximately 5.8 million Americans are diagnosed with heart failure, with 670,000 new cases diagnosed annually. This accounts for greater than 3 million hospitalized admissions per year. Heart failure is the single largest expense for Medicare, with a 5-year mortality rate as high as 50%. The estimated medical cost related to heart failure is estimated to be greater than $39 billion per year, with $500 million spent on medication for heart failure annually. Additionally, the cost to the American public is estimated at $26 to $60 billion annually. Clearly, we can see the cost of heart failure is significant. Could this cost to human health and our economy be ameliorated by patients being able to take better care of themselves? Putting the epidemiology of heart failure into the content of other issues, note that there are more deaths from heart failure than from all forms of cancer. So we can see heart failure is a serious, common, and leading health problem in the United States. Heart failure is also a global health problem, with infectious disease being a significant cause of heart failure in developing countries. How can we alleviate this ongoing health problem? One of the best approaches to minimizing the morbidity and mortality from heart failure is to encourage patients to optimize their health through self-care through patient education. In order to educate patients effectively, nurses must have a comprehensive knowledge of heart failure and the ability to share that knowledge with patients and their caregivers. When heart failure occurs, it can affect either the right or left side of the heart, or both sides simultaneously. Let me discuss the types of heart failure. Right-sided heart failure is the inability of the right ventricle to pump adequate blood to the lungs, thereby leading to venous congestion. Left-sided heart failure is the inability of the left ventricle to produce adequate stroke volume, leading to decreased cardiac output and resulting in pulmonary congestion. Understanding these concepts is very important for nurses because nurses can identify the patient's signs and symptoms caused by venous congestion or pulmonary congestion. Most often, both sides of the heart are affected in heart failure. Both right and left-sided heart failure results from the heart's inability to pump enough oxygen-rich blood to the systemic circulation. As the heart's pumping action is lost, blood may back up into other areas of the body. Fluid builds up in the lungs, liver, gastrointestinal tract, arms, and legs. Dyspnea, fatigue, edema, and anorexia are the cardinal signs and symptoms of heart failure. Patients should be aware, understand, and be able to identify the different types of breathing that are considered not normal. Paroxysmal nocturnal dyspnea, waking up gasping for breath. Orthopnea, shortness of breath when lying down. Dyspnea on exertion, shortness of breath with activity. Symptoms of heart failure often begin slowly. At first, they may only occur when the patient is very active. Over time, patients may notice breathing problems and other symptoms even when they are resting. Heart failure symptoms may also begin suddenly after a heart attack or other heart problems such as a dangerously high heart rate or shock. Symptoms can often be managed if the patient is able to recognize signs and symptoms of heart failure before they get worse, and they can quickly follow treatment modalities prescribed. Unfortunately, patients are not able to follow treatments due to many reasons which act as barriers to fully participating in their healthcare treatment plan. We as nurses need to identify those barriers and find suitable approaches to help patients to manage their health needs as much as possible at home. There are many common symptoms of heart failure, such as weakness, fatigue, exercise intolerance, confusion, lethargy, hallucinations, insomnia, abdominal pain, edema, weight gain, shortness of breath, waking up from our sleep. What's important is to use words and terms that our patients can understand, such as the word edema. Most patients may not understand this word, so using a term like swelling when referring to swelling of our feet or ankles is important. Now we will talk about in-depth signs and symptoms related to heart failure, which includes fast or difficult breathing, known as tachypnea or dyspnea, irregular or abnormal heart sounds, such as an S3 gallop or murmur from turbulent blood flow, leg edema if there is backflow of blood into the extremities from the right side of the heart, distended neck veins, also characteristic of right-sided or bilateral heart failure, abnormal lung sounds such as crackles, also known as rales, bronchi, and cardiac wheezing, edema of the liver and abdomen seen by abdominal distension and prominent venous pattern. Now I will explain the treatment modalities for heart failure in closer detail. Do you recognize the responsibility the patient has to follow the prescribed treatments? These include following a low-sodium diet. We need to emphasize that delicious flavors such as garlic, cinnamon, cilantro, curry spices can flavor their foods wonderfully. Taking their prescribed medications regularly. This may involve teaching patients how to use a pill sorter, which will help keep them from guessing whether they have taken their morning, afternoon, or evening medications. Monitoring their body during rest and activities for signs and symptoms of worsening heart failure, discussed in slide 14, is very important. Exercise includes simple activities that can be tolerated, such as slow walking for short distances, which does not cause excess fatigue or shortness of breath. Weighing oneself daily on the same scale at the same time is an important tool monitoring worsening of heart failure. A weight change within 1 day of 3 pounds needs to be reported to their physician. It is important to teach patients to engage in preventive behaviors such as not smoking, eating a heart-healthy diet low in fat and sodium and rich in fiber, and foods that are close to their natural sources possible, which include a rainbow of colors. Making decisions in response to signs and symptoms they experience, which indicate the degree of heart failure they are experiencing, stable, worse, improved, and following up with healthcare providers. As you can see, patients have to follow complex treatment modalities. Therefore, we can educate patients to use heart failure zone tools as a guide to recognize common and in-depth signs and symptoms to take appropriate decisions and actions to maintain optimal health. Simply, we need to educate how to take care of themselves. Teaching patients the level of health they are experiencing based on green, yellow, and red zones is simple and a practical tool most patients can use. Which zone are you in today? Green zone indicating that patients are feeling well, stable, and able to manage and maintain their self-care. Yellow zone indicates caution. A change from baseline has occurred. They are feeling worse, needs to follow up with appropriate actions to maintain their health. This means the patient must have a clear understanding of the signs and symptoms and to take proper actions accordingly. Red zone equals emergency. You are in danger. Significant changes put them in danger, and negative outcomes such as cardiovascular collapse and death can occur. Emergency follow-up is needed. This is a good tool that we can use when educating patients because this guides heart failure patients to recognize their current status so they can act accordingly when changes occur. Now you understand the importance of patients to have this knowledge and skills to maintain self-care. Breaking down just what the green zone means for patients is very helpful for them. All clear feelings means your breathing is normal, you can do activities without shortness of breath, your appetite is good, you are able to rest comfortably and can think clearly. Actions to follow which maintain the green zone include take medication as prescribed, be active and do exercise, eat healthy foods, balance activities with rest periods. When you talk with a patient, it is important to tell them what being in the yellow zone means. They may not be feeling well and may be experiencing the following: shortness of breath, changes in their weight, feet, legs, or ankle edema. They may be unable to do their usual activities. They may be unable to sleep. Their symptoms wake them up at night. Actions to follow: limit their activities. And please be very specific by getting to know what the patient normally does in a day. Make sure they take all their medications. The use of pursed lip breathing. Weigh themselves and call their physician if greater than 3 pounds in one day or greater than 5 pounds in 1 week is gained. Eat smaller meals rather than larger meals. Call their physician if symptoms do not improve. Tell patients what being in the red zone means. They are in danger if they develop severe shortness of breath, have shortness of breath while resting, they are more sleepy or difficult to stay awake, they feel drowsy or confused, they have a bluish color to their fingernails or lips. Actions to follow: call 911 or go to the hospital emergency room. Again, you can understand the importance of patients to have this knowledge and skills to manage self-care. Referring back to objectives discussed in slide 3, we will now talk about self-care management of heart failure. What do we mean by self-care? Self-care is an active cognitive, requiring thinking, process during which a patient is engaged to help manage their disease by identifying symptoms and what actions are required in order to follow treatments prescribed for their care. Self-care also involves knowing how to observe one's own body to know whether treatments are helping. Patients engage in self-care for the purpose of maintaining their health or managing their disease and illness primarily includes medication adherence, dietary adherence, exercise, identifying symptoms, knowing when they need to take action, action on that need, and evaluating the effectiveness of each treatment prescribed to manage heart failure. As patient advocates, we need to encourage heart failure patients to follow their prescribed treatment modalities, which are designed to help to minimize the impact of having a weakened heart. Treatment modalities for heart failure management are multiple and complex. That is why we as nurses need to guide patients to follow treatments as prescribed and make sure they understand what they need to do to take care of themselves. The treatments we want to encourage patients to follow include medication regimes, following a low-sodium diet, monitoring signs and symptoms of their disease, remaining physically active with activities that their heart can safely tolerate, weighing themselves daily, keeping follow-up appointments. Patients benefit from knowing that a diet low in sodium doesn't mean it can't be colorful, fresh, and flavorful. We need to emphasize to patients that they need to be active partners in their self-care because inability to maintain self-care has negative consequences, including the need for a higher level of care or support they cannot safely sustain independently. Without participation of the patient in their own health care through self-care, there may be worsening of their heart failure, continued readmissions to the hospital, and generally a decreased quality of life. Other negative consequences or outcomes, such as being unable to attend family celebrations or other social functions, and generally not being able to enjoy life fully. One of the best approaches to enhance self-care management is through patient education. By using the teach-back teaching method, the nurse can ask patients to repeat back in their own words what they understand from what they've been told. What if your patient is unable to repeat the information correctly? Then you need to critically think what barriers may hinder the patient's ability to learn and what you are trying to teach them. As an example, if the patient does not understand the words that you use, rephrase the information using more simple language rather than just repeating it. So throughout the patient education process, it is important for the nurse to identify heart failure patients' barriers to learning, such as vision or hearing problems, the inability to read, arthritis, which can make it difficult to open medicine bottles, for example. Identify their health literacy levels. Create a patient-centered teaching environment without distractions, with good lighting, and in a comfortable environment. Involve family members or caregivers in the teaching experience whenever possible. As you can see, teaching is a vital component of nursing practice. Therefore, it is important for us to critically think and to use best approaches in patient education. Let me present to you these patient education principles as a tool to keep in mind during patient education. Make sure to acknowledge the patient by name. Make eye contact, smile, remember the power of touch. Introduce yourself. Verbalize the purpose of the meeting. Share with the patient a little bit about who you are so the patient can make a connection with you as a knowledgeable healthcare professional. Gathering information. Nurses should also use layman's terms instead of medical terminology, going straight to the point, making the session brief but concise, and maintaining good interpersonal communication. Also, explore patients' knowledge and ability to learn, identifying barriers to learning, and plan accordingly as to what approaches and interventions are appropriate for the patient. Verify how much the patient has understood from the discussion by asking open-ended questions. Encourage them to raise questions about things that they want to know regarding the topic and clarify for mutual understanding. This guides you to evaluate patient teaching effectiveness. Before you begin to teach, the nurse should first identify the factors that may affect the patient's learning process. As an example, physical barriers such as unable to hear, see, or write. Psychomotor barriers such as health literacy, learning disabilities, comorbidities such as depression, and other factors such as age, readiness to learn, language barriers, cultural diversities, and family support. This means that our patient approach must be individualized, and these factors will determine the type of approach the nurse needs to select when educating the patient. Remember that if patients are in an acute environment, their teaching should be brief. In order to identify patient barriers to learning about what they need to know and need to do about their heart failure, a good baseline assessment is key. We learn about our patients as we interact with them as people, not just discussing their disease, but also knowing a little bit about their roles in life, maybe the music they enjoy or the relationships that are important to them. Having a relationship with our patients as people strengthens their trust in their nurses and in the information that they receive from their nurses. As a result, they are more likely to not only learn, but to perform what we advocate will be helpful in their health and disease management. As you teach your patients, look at them in their environment. Are they smiling? Do they appear relaxed? Do they seem to be enjoying their day and their life? Do they have the assistive devices they need to navigate their environment safely? A patient who is able to talk, laugh, and engage with you without signs of distress or discomfort is likely coping quite well with their heart failure. Family education is also crucial because family members are the constant caregivers at home. Nurses need to involve family members during patient education because they need to have adequate knowledge regarding treatment modalities so they can encourage their family members to maintain healthy lifestyles. The family needs to know how to assist the patient, observe them for increasing shortness of breath, fatigue, and exercise intolerance. How to help patients adapt to the realities of heart failure and the changes in expectations and activity levels this may require. And to know the importance of participation alongside their loved ones in facilitating and maintaining a smoke-free home. As patient advocates, we want to make sure each heart failure patient is capable of doing these tactical skills and identifying any barriers that may interfere in their accomplishments. Involving family members and caregivers to achieve these tactical skills is an important part of this process. Heart failure patients need to know how to identify and differentiate the signs and symptoms that may be similar to heart failure from other diseases in order to get the appropriate follow-up and intervention in a timely manner. Also, the patients need to understand guidelines from their doctor, such as when they may need to take an extra dose of their diuretic. Now I will explain one of the best methods that we can use to educate heart failure patients. The teach-back method will help the nurse to make sure the patient understands what he or she needs to know and do. It is a simple approach to verifying the patient's understanding. You may need to present learning materials in multiple formats, such as playing a short video, providing a pamphlet, or even drawing stick figures. All it requires is for the patient to tell you in their own words what you have taught them in managing their heart failure. This diagram shows you how the teach-back method works. Simply, teach-back is a way of confirming what you have explained to the patient, what they need to know, in a manner that the patient understands. After the clinician introduces a new concept to the patient, they need to ask the patient to explain the material just covered. Based on the response, the clinician assesses patient recall and comprehension to what was taught. Then the clinician clarifies and tailors the explanation and reassesses patient recall and comprehension. It is important to repeat this cycle until the patient understands what is being taught. In this slide is the Heart Failure Society of America's guidelines of what heart failure patients need to follow. This summarizes all self-care management activities to be maintained at home. In summary, effective communication plays an important role in patient education. This includes active listening, showing respect, and having empathy to help gain the patient's trust, creating the best learning environment by centering the patient as the key learner. As professional nurses operating as patient advocates, we have the privilege and responsibility to educate patients effectively. We can do that by identifying their barriers to learning, by using the best teaching methods to educate them, and by evaluating and confirming patients' and their families' understanding. Thank you for your time, your interest, and for participating in this worthwhile project. We appreciate your professionalism and believe that your contribution will be an incredible help to so many patients and families.